Good evening from New York. It is an industry so rapacious, so intoxicated by profit that it is now lobbying to increase the punishment of anybody who might in the future fail to buy its product. An industry so evil that, as the New York Times reported today, it ostensibly kept two brothers, the Waddingtons, from donating a kidney to their own father under the threat that if they tested positive for the same disease that was costing their father his kidney, they would likely be denied insurance for the rest of their lives because of a pre-existing condition. Our fifth story, and tonight, America's insurance cartel now complaining to Senator Max Baucus that he hasn't done enough for them. Senator Baucus is the chairman of the Finance Committee, says today that he expects the Congressional Budget Office to be done scoring his health reform bill by tomorrow. Mr. Baucus did not say, however, when he might be staging a vote on his bill. That bill set to deliver millions of new paying customers subsidized by the federal government to the private insurance industry with no public option to provide pesky competition. The insurance industry now claiming that last week when the Finance Committee dropped the penalty for not buying coverage to $1,500 per family from an original $3,800, it left the fine so weak it is practically begging to be ignored. After the bill leaves the Senate Finance Committee, it would need to be joined with the other Senate bill. The Senate and House bills, it is hoped eventually to be merged together as well. Roll call reporting that the White House is to be represented in the negotiations by Chief of Staff Rahm Emanuel, among others. The newspaper reporting that Senate aides are letting it be known that the White House will have to lead on all the issues around which Democrats have been unable to find consensus, issues like the public option. Speaker Pelosi again saying that the final bill will have a robust public option in it, at least in the House. Meanwhile, back in the Senate, no word yet on how the final health care vote might survive a filibuster. Senator Ben Nelson of Nebraska telling TalkingPointsMemo.com that the Democratic leadership has not discussed overcoming a key cloture vote with him on any issue. As for the Republicans, Congressman Alan Grayson clarifying his comments in which he said the Republican health plan is don't get sick, and if you do get sick, die quickly. It's not that Republicans want you to die quickly, explained the Florida Democrat on local radio in Orlando. It's just that Republicans don't care.
Honestly, the people I deal with, the people I actually am across the aisle with every day, I don't think they care about ordinary people. I don't think that the Republicans in Congress actually have a heart. I'll be honest with you.
Well, Dick Cheney.
But that's not the same as saying they want you. I mean, yeah, let's get straight what I said. I said their health care plan is
die quickly.
Don't get sick. And if you do get sick, then die quickly.
Die quickly.
And what do I mean by that? Because if you get sick and those bills are mounting and you're in the hospital and you're feeling weaker and weaker and you've got no way to pay for any of this, then what are they going to do for you?
All right, here's my
question. They're going to do nothing.
Time now to call in our own Lawrence O'Donnell, former Chief of Staff to the Senate Finance Committee, now a Huffington Post contributor. Lawrence, good evening.
Good to be here, Keith.
I asked this question of Howard Feynman yesterday, but I'm interested in learning your answer to it as well. If the CBO comes back tomorrow and says, hey, guess what? This bill does add to the deficit, whether it's $1 billion or $1, what happens then? Where would this process go next?
Oh, boy, that puts things into a very sharp U-turn for a while. There would be an immediate call to the White House, because remember, the demand that this health care reform reduce the deficit is a Barack Obama demand. He's the one who put that on the table as something the bill has to do. So first call has to be, Mr. President, is this a veto item? Do you really need this? Max Baucus has to decide whether he needs it, because he's strongly supported the president on that position. And if they need it, it means they're going to have to, basically, to bring the cost of the bill down, you take good things out of the bill. You take things that do people good out of the bill. You take benefits out of the bill. That's how you reduce the cost.
Having Mr. Emanuel in the room when the final single bill is merged, drafted, I mean, he knows the process. Obviously, he's a skilled negotiator. Obviously, he's tough as nails. If the president really wanted a public option, would not this man, this chief of staff, be the guy to deliver it for him? Is it all a matter of what the president actually wants?
Well, you know, presidents want a lot of things, and the question in the room is, will the president veto the bill if it doesn't have the public option? Is this a deal breaker for the president? That's the question to Rahm Emanuel in the room, and he has answered that question. He answered that question back in January when he said, basically, everything's on the table. We will do anything to get a bill. In this respect, Rahm turned his cards over much too early and much too publicly. It seemed possibly like a good idea at the time, because it was the opposite of the Clinton strategy. But he's been very clear about he will take a bill without it, and the president has been pretty clear that he'll take a bill without it.
What do they do then? Do they really believe they can come back and fight this fight again next year or the year after or at some point in the future to get other things? Or will they have been so sapped by this process that this will be the end of it?
That's what happens. These crusades are so huge that they take all the energy out of the institutions for any coming back at this for another few years. And one of the most unfortunate lines, I think, in the president's speech was when he said, I'm not the first president to take on health care reform, but I will be the last. Now, he said that, unfortunately, knowing that every one of these bills leave tens of millions of people without health insurance. None of these bills in any of the committees are universal coverage bills. So when the best one of these bills is enacted, you're still going to see people lose their homes through bankruptcies based on health insurance and the failure of health insurance. And so, yeah, you would have to come back and do a lot of repair work on these bills if any one of them passed.
A new AP poll is out tonight. It shows the president's approval numbers started to rise again last month, 56% in the past week approving of his job performance. It was 50% in September. 48% said they approved of his handling of health care. That's up 6 points from September. On health care reform, is anything really holding the president back other than the president?
Well, the CBO is holding him back. He's really waiting to see how does this Finance Committee bill score out. Does it meet my requirements? Is there something here that meets all my requirements as enunciated in that speech? So he's waiting for that.
The horrific stories about insurance companies and what they might still be able to do under what is being called reform that really looks like it's benefiting them more than anybody else. Insurance companies complain that they're not being given enough in the current deal. Was Congressman Grayson wrong, in fact? Could it not be that the Republicans don't care, but if they deliver a bad bill, reform that doesn't reform, is it the Democrats who don't care?
Well, the Democrats definitely have a big heart, and they care about the people who don't have health insurance. But what we've seen so far is they don't care that much about what's in the bill. They just want a bill. They want to pass something. And the trouble with these policies, the individual mandate, there's a lot of ugly aspects to that policy. And that's true of a bunch of the policies that are in these bills. And those ugly aspects aren't being massaged in a way that makes them more acceptable. I mean, these bills are very difficult for liberals to watch pass through here because liberals wanted to go with opening up Medicare, a system that we know how it works, we can describe it, it's a very successful system, and so liberals didn't get a chance to open up Medicare, to put that on the table, and instead they're left defending these very complex and in many cases very ugly ideas like the individual mandate that is a huge benefit for insurance companies, is punitive to people with low incomes. It's a tough thing for liberals to watch, and at some point the question becomes, is this a bad enough bill that from the left you should vote against it? I don't know exactly where that line is.
I'll agree with your statement, but amend it only slightly. These are very difficult things for humans to watch go through. It doesn't have anything to do with liberals. Lawrence O'Donnell of MSNBC and the Huffington Post, formerly of the Senate Finance Committee. As always, great thanks.
Thanks, Keith.